Okay, let's move on. Dr. Cole, an interesting subject here that I've never heard of. You've, I know, done some research on this. The association of a lower extremity injury following concussion in high school athletes. What is that all about?
Well, I look forward to hearing more. I will tell you that what's interesting is we talk about concussions a lot, about the symptoms of amnesia. You don't remember the event, headaches, photophobia, where you're really light sensitive, can't concentrate, and things of that nature. But I suspect that this topic has something to do with motor function, your coordination, something neuromuscular, or even balance related, that there's some association. So there's some new research in this area that we kind of all have to be aware of, because concussion is so much more than just getting your bell rung and having issues with concentration and all the potential brain injury. It's much more than that.
Let's bring on our next guest here, Ellen Shanley. Ellen is the doctor of physical therapy for ATI Physical Therapy and a clinical research scientist. And Ellen, thanks so much for joining us. Increased risk of the lower extremity injury within a year following concussion has been documented in the sports medicine research. Can you tell us more?
Yeah, so I think Dr. Cole really pointed out the theory is that people recovering from concussion will have some balance and coordination issues. And so there's been some research into this increased risk post-concussion. Concussion is a huge topic for us because we work in high school sports with people that have developing brains. And so the thing we were really interested in is, well, maybe if balance and coordination are a cause of lower extremity injury after concussion, maybe lower extremity injury might increase somebody's risk of having a concussion if they go back to sport early on. And so that was the goal of our work, was really how can we do more to prevent concussions in these athletes, high school athletes.
So, okay, I got it. So you took it. So this is interesting. So I thought that the work you did showed that people have a concussion and have a subsequent increased risk of lower extremity injury within a year. What I heard you say also is that does a lower extremity injury potentially lead to the risk of a concussion?
Yeah, so that's really what we wanted to look at. And so we've been looking for 4 years into a large group of high school athletes to see if there really is this association. And we found out that if you had a lower extremity injury, like, say, an ankle sprain or a knee sprain in one particular season, so we looked at about a 90 to 120-day span, you had a 5-time greater risk of having a concussion following this within that time frame.
So that's fascinating. So that's fascinating. So that if you asked me what our hypothesis or what I had to guess what would happen, I would say no different. So you got to tell us what's the connection? Why?
Well, I think, in part because we sort of let people, if they can still play, we try to tape them up and do a little bit of work with them, but we may not really normalize their balance and their ability to bear weight on each leg or run with really good motor patterns. So we think they're probably not as well equipped to protect themselves and get out of the way, especially in the contact and collision sports where we found the risk was higher than sports that are not so much contact and collision. So comparing like lacrosse to volleyball, we saw a much higher incidence in lacrosse and even soccer.
Yeah, so I think what the listeners have to understand is the fact that you have a concussion and potentially have lower extremity injury, I'm going to guess, as we talked about, that's due to balance and the brain trauma. But the lower extremity injury has nothing to do with the brain except that you get a concussion more likely. Is that correct? Is that
right?
That's about right. So they're different, obviously completely different pathways. Does that make sense, Steve? Did I confuse you?
No, that's all right. Yeah, I get it. I get it.
I mean, it's confusing, but I would have never put the two together. So did you guys find a statistical difference in terms of the normal population who did not have a lower extremity injury, you saw a propensity or a frequency of concussions in people who had a lower extremity injury compared to the normal population?
Right. So the relative risk was 5 times greater, and it was very significant because we were able to have a really large group. We followed about 33,000 athletes over this 4-year period. And so the confidence interval around that was between 4.5 and 5.7. So this is an abstract we just submitted to AOSSM because we feel like this is really important information that could potentially help in terms of prevention of concussion.
Yeah, startling stats. Again, our guest is Ellen Shanley, Doctor of Physical Therapy at ATI Physical Therapy. You're listening to Sports Medicine Weekly on this Saturday morning. Steve Cashel, Dr. Brian Cole. How about ways to decrease risk, Ellen?
So we think that some of the more important things are really making sure that as we return athletes to sport, we continue to look at their balance and look at their ability to really make sure that they can run and cut evenly from side to side, and they're really able to take care of themselves when they go back to the field. So it's more than just taping and looking at motion and strength. We really need to concentrate on their balance and their ability to function at a really high level.
Well, I will tell you that if I have anything to do with getting your abstract accepted at the AOSSM, I'll see if I can help. It's super useful information. This is absolutely worthy. So congratulations, and I look forward to seeing you guys publish the study.
Well, thank you so much. We appreciate the time.
Ellen Shanley from ATI Physical Therapy. Thanks so much, Ellen. Time for a break here on Sports Medicine Weekly. When we return, it's our staple of the show, our Ask the Doctor segment, giving you listeners a chance to ask Dr. Brian Cole a question via our website. Our website is sportsmedicineweekly.com. I'll have a whole list of questions for this week's show, so stay with us. You're listening to Sports Medicine Weekly only on
670, The Score.